Hello everybody, nice to see you all here. Good evening to those who are joining us from Europe. Also, good morning to those who are joining in from United States. So, we have a very special webinar today for you. We're going to be joined by the world-renowned expert in the aerosol sciences, Dr. Jose-Luis Jimenez. That's gonna be in a couple of minutes. So we are for the second time here in the RNet and SOF studios. You might notice something different. Those who joined us in the Dr. Berger webinar, we have this lovely wall of plants here, and if you stay tuned till the end of the webinar, we're gonna talk a little bit about that as well. As always, this webinar is brought to you by RNet. So RNet is this device that measures CO2, and it has become very topical in the context of the pandemic, as we will discuss also today with Dr. Jimenez regarding how CO2 measurements can also facilitate the elimination of risks concerning COVID. So yeah. Essentially, I'm going to talk also about RNet and all of the benefits of the system itself at the end, so stay tuned for that. So this has been one of the most popular webinars so far because we have had somewhere around 500 people that registered, and I see that more and more people are appearing online here in YouTube as we speak. So, and also we had a lot of very interesting questions that you sent in, and actually today when I was going over the questions, there were few that were really good, and that actually made me kind of restructure the whole webinar a little bit. There were more than 100 questions sent in, so obviously we won't make it to answer all of the questions, but so there is one thing that I want to get your attention to before we start the webinar. It is that Dr. Jose-Luis Jimenez, together with his colleagues, they have prepared a special frequently asked questions regarding aerosol transmission. And this is a very, very, very interesting and very detailed explanation, but it's written in a very understandable language. And today we also put a reference on it on our web. So if you want to read it after the webinar, we're going to have that also in the description later on in the webinar, but you can also go to our website, and on the news part, if you go into the news, you can see the FAQs on protecting yourself from COVID-19. So this is a document that you can read that the scientists have all prepared. So if you don't get your question answered in this webinar, I definitely recommend you checking out this FAQs, because most probably 95% that your question will be answered there as well. So that is for the introduction regarding all of these technical matters. And now we are joined by the professor of chemistry from University of Colorado, Dr. Jose-Luis Jimenez, who has been one of the most vocal, outspoken aerosol scientists in this whole airborne COVID saga, and has been very active in social media and such, trying to educate people. So, hello, Jose.
Thanks for the invitation, and thanks for the opportunity to be here.
No problem. Let's jump into the questions, okay? So I guess we've had a previous kind of webinar explaining a bit from the point of view of an actual doctor who has worked on the front line in this whole COVID in this battle against COVID, but it's also very interesting to hear kind of this perspective from a scientist. So how do we know that COVID-19 is transmitted via aerosols?
Well, there is a lot of different pieces of evidence that point us in this direction. First of all, when we measure the breath that's coming out of people, we see that many people have virus coming out of them just as they breathe. And we know that when we talk or when we especially shout or sing, more aerosols come out. And for other diseases, we know that they also have the virus. Then we know that this virus survives in the air for a couple of hours. And we know that we can breathe it in and that we have receptors where this virus can attach all in the respiratory system, from the nose to the trachea to the lungs, right? So it's totally plausible. But then we also know we have many different pieces of evidence. The clearest one is the cases of super spreading, in which one person may infect 20, 30, 50, up to 200 I have seen. And in that case, people are sharing the air in a room, and basically the only possibility for them to get infected is through the air. We have investigated the case of the choir here in the US, and we wrote a scientific article, and basically it was the only possibility that could explain that super spreading event. But there are many others. You have seen in the news the restaurant in China and the bus in China and there's many other choirs, and they all are the same thing. People stuck in a room with no ventilation for a long time. So that's a very clear piece of evidence. And then another one that may surprise some people, when a disease is transmitted well when we talk in close proximity, people like a WHO used to think that this means it's a disease that's transmitted through droplets, but modern science tells us that no, what's going on is if this person is infected, this person is breathing the air that this person is exhaling, and that's how they are getting infected. I could go on and on. There is much more evidence, but I think that's probably enough.
So when we say aerosols, I think this is something that a couple people might be like confused about. So how is this different than this regular transmission route, these droplets and all of that, which is the status quo, let's say, of the transmission? How is that different?
Well, so there are three ways for these respiratory diseases that they can go from one person to another, right? And one is through touch. You know, you touch someone else's hand, or you touch a surface that's contaminated, and then you touch the inside of your eyes, the inside of your nostrils, or the inside of your mouth, and you can get infected that way. The second one is through spray. This droplet of WHO is a spray. You know, you talk, you get excited, or you cough or you sneeze, and these visible droplets come out of you, and they can hit someone again in the inside of the eye, the inside of the nostrils, or the inside of the mouth. If this happens, you can get infected. The third way is through aerosols. So the droplets are just little balls of saliva or respiratory fluid that, as I said, come out of us and behave like little cannonballs, like projectiles. Mm-hmm. The aerosols are the same material, but they are much smaller, and they behave like smoke. They are not a projectile that either hits someone or falls to the ground, but they come out, they stop by the friction of the air, and then they float around, and then we can breathe them in. Right, so that's the difference between the droplets and the aerosols. And WHO and CDC and a lot of the health ministries have been telling us that it's really these projectiles, that's how we get infected. But that is wrong. Really, how we get infected is by breathing the virus in, and that's what we need to protect ourselves against.
So you would say that actually the aerosol route is the dominant route even, because there is some discussion, okay, so now we have enough science that we say that definitely, aerosol transmission is possible, but you are even like saying that it might be the main route, how people are...
We know it's the main route, and we have known for a long time. CDC in October last year already put on the webpage that inhalation is the main way the virus spreads. So this has been known for a long time. The thing is that they make it really confusing, but it is known for a long time that surfaces, we have 100 million cases of COVID. There is 0 cases that have been shown to be transmitted by surfaces. And WHO and CDC agree that there is 0 cases that have been demonstrated to transmit through surfaces. And these droplets projectiles, there were some historical errors in the science that CDC and WHO were following, that they had some things very, very wrong. And we now know that they are not very important. They are only important if someone coughs or sneezes on your face. If someone coughs and sneezes very close to you, towards you, then yes, these projectiles can impact you, and then that's not good. That's why they wear sometimes shields in the hospitals, right, in case someone coughs in front of them. But for the large majority of transmission, we're getting infected by breathing the air that comes out of someone else in 2 situations. When we talk to someone close, right, like if you talk to someone who's smoking, there is a lot of smoke in between you. The situation, like if you can smell the garlic on someone else's breath, is because you are inhaling the air that has just left that person without much dilution. That's very, very dangerous, and there is a lot of transmission. But then if you're keeping your distance, but you are sharing the air in a room, the walls and the ceiling are trapping the air, and if you share the room for enough time, you can also get infected. And that's the only way you can infect 10, 20, 30, 50 people. And we know for this virus, between 10 and 20% of the people who are infected infect 80% of the new cases. Well, there is many people who don't infect anybody. And that is explained because there is many people, 3/4 of the people, when they measure them, they don't put any virus in the air. But there is about 25% of the people who are exhaling a lot of virus, right? So it's a disease, it goes through the air, but it doesn't go through the air from everybody. There is people who transmit, and there is many people who don't transmit, or who transmit very, very, very little.
I see. So you mentioned this smoke analogy. So is that a good analogy that we could use to imagine, let's say, how that aerosol is spreading across the room?
It is the best analogy we have found. Because smoke is an aerosol, and then you see that it comes out and it stops and it floats. And we're used to seeing that what the smoke does depends on the room. If you have a fan, it will disperse. If you're in a very quiet room. But if you are in almost any room, you may see someone start to smoke, and at the beginning you only see the smoke, but after 10-15 minutes you smell it, right? And that's how it behaves. With time, in any room it's gonna mix. And it's also useful because outdoors, the smoke may rise, or the wind is gonna take it away much faster, and this basically explains why there is so much less transmission outdoors. Outdoors, the only way you can get infected really is if you talk close to someone, because that gives you a chance to inhale their smoke. Now, smoke is not perfect in a couple of ways as an analogy. One is that the smoke has what's visible, what we see is the aerosols, but it also has gases that smell, and those gases go through masks, just like the air that we breathe, and and they may stick to a wall, so it's not perfect when you go to a long time, and also the smoke is too strong compared to the virus, right? So you may smell smoke on the street by someone who you cannot even see, and then people get worried, am I gonna get infected? No, smoke is stronger, but in terms of seeing what happens when the virus or when the smoke comes out of a person, that's what's really, really useful.
So how long then typically, and also both in indoors and outdoors, how long do these aerosols linger in a room?
So indoors, in a room, it's basically 1 or 2 hours, and there is, They will be eventually ventilated outdoors. Even a room that's closed, there is always some infiltration. Otherwise, we would suffocate in a room. If we will run out of oxygen, there is always air coming in. And then the virus loses infectivity in 1 or 2 hours. It doesn't die immediately, but in a couple of hours, it stops being infective in the air. And then it also these aerosols slowly settle. They don't settle very quickly like these droplets, but in a couple of hours. So what's really dangerous, and when you see a lot of transmission, is when people are sharing the air, breathing the same air at the same time for a long time. That's when you see 10, 20, 50, 100 transmission. It's not, if you go into a room where someone else was there that was infected, but they left 2 hours ago, I would say it's very, very difficult to get infected that way. With more contagious diseases like measles, you see that. You go into a room and you can get infected 2 hours later. With this disease, I think it's really, the virus is not very contagious. The problem is that we make it easy for the virus all the time. We talk closely without keeping the distance, without masks, or we share the air in rooms for a long time without enough ventilation and with masks that don't fit very well.
Wow. Okay. So that kind of illustrates clearly this problem and this issue. And once you have actually somebody who's competent and like you explaining this, then it kind of makes sense. But the problem is, and there were a lot of questions based on this, that we have this kind of mysterious guidelines from the WHO that don't really look that much about ventilation and all of that. And the question is, what is, like, for yourself, for example, what is the best way to educate people? So if these people that are watching the webinar now, they go away smarter, how can they transfer this knowledge? So maybe you can give some suggestions.
Well, yeah, it's been really frustrating that for historical reasons, the public health organizations like the WHO or here the CDC or the ministries in many countries have been really, really confused and have not told us how this disease gets transmitted. And they told us it was through surfaces, even though there was no evidence. And we have disinfected a lot and all that. And there was no evidence, and there is still no evidence. And they still don't tell us it doesn't go through surfaces, it goes through the air. Now, once you understand how to protect yourself, so you mentioned our frequently asked questions. That's basically where, people were asking us questions very frequently, and we kept typing in Twitter or whatever the answer. So I said, why don't we put it in a web page so we don't have to type it up all the time and we can improve it over time. So I would say, it's long, but basically that has basically every question anyone ever asked me is already answered there. So if you take the time, the information is there. But I would say at the end, it's not that hard to understand. If you think that everyone that could be infected, even in your own house, if people work in different places, is exhaling this invisible smoke, and what you want to do is not to breathe that smoke, or not to breathe it without it going through a mask, being filtered by a mask, then everything becomes clear, right? So you want to wear a mask that's good and that's well fitted, that doesn't leave any gaps. You want to ventilate, you want to open the windows a little bit, you want to think outdoors whenever you can, you want to keep your distance from other people, because we said if you are close to someone, then you are inhaling more of the air that's coming out of that person. So these are all things that are common sense once you understand, what you need to do.
Right. Yeah. So you also mentioned that smoke and the mask, and there have been videos circulating around online that these mask skeptic people typically put on a mask and blow out smoke, and they're saying the smoke is leaving the mask. See, the mask is not working. What do you say to those types of people?
Those people don't know what they're talking about. There is two errors that they're making. One is, if you smoke a cigarette and then you put a mask that filters 90% of the aerosol, there are so many aerosols that even the 10% that escapes is invisible, right? But then many times people do this with vaping, and vaping is a vapor. So then, and it has, so inside of you, it's present as a vapor. It crosses the mask as a vapor, and then it forms aerosols on the outside. So,
Right.
so actually the mask is filtering the aerosols, but the gases are going through as the air that we breathe. So it's basically people who don't understand the aerosol science, and they're making fools of themselves.
Probably most people up until this year had not even heard about aerosol scientists, and now suddenly you guys are superstars. But going back to maybe this problem regarding the status quo and the public perception, there were a lot of questions regarding why do you think that is, that this aerosol transmission evidence needs to be a lot stronger than other evidence, and why do people perceive aerosol transmission so differently than fomite transmission and all of those?
Well, let me try to explain it briefly. This is due to history. There was a huge historical error that has persisted for 110 years, and the pandemic has uncovered. So very briefly, in the 1850s, there was an observation that distance, if you kept people who were sick more distant, that would reduce transmission, social distance, right? In the Crimean War, it was observed. And then Pasteur discovered germs, and then there was a lot of research about, how diseases get transmitted. And there is a critical book in 1910 from Charles Chapin, who's an American public health researcher. So this researcher, makes a lot of advances in this book that are, very, very important for reducing infection, but makes a critical error. He interprets that when people get sick in close proximity, this is because of these projectiles, these droplets that are hitting someone else. And he says that transmission through the air is almost impossible. And then the problem is that the rest of the book is very good, but it has this critical error, but the whole book becomes the textbook and becomes a dogma in epidemiology. We call it the Droplet Dogma. And then the problem is that all the way to today, the people who is at the top of WHO or CDC or all the health ministries? Epidemiologists. And these epidemiologists for 100 years have believed that transmission through the air is almost impossible. And one example is WHO has a committee to decide if there is a new disease, to decide how this disease is transmitted. This committee has 6 experts on washing hands and all these things, but it has 0 experts on transmission through the air. Because transmission through the air, they view it as it's almost impossible. So why would you have an expert on transmission through the air? So they really, to them, it seems this is something very, very, very difficult. And they, when we talked to them on April 6th last year, we told them, you don't really have evidence that this disease is transmitted through surfaces or through droplets. And they were like, yeah, but we know that's transmitted that way because...
it's dangerous.
And then we said, but we have more evidence for the air. And they said, no, but you need much more, because the air is so unlikely, so impossible that we really need much more evidence. And it has really taken them a long time to move in this direction and accept what is now absolutely overwhelming evidence that the disease is mostly transmitted through the air.
So that would have followed into my next question, because as I've followed this whole development and all of that, I think there are new papers coming out almost every week, if not every day, regarding this, and how big does the pile of evidence need to be until they look at it, right? So,
I mean it's hard, when idea is very entrenched. This is what in science we call a paradigm shift. And there is a great book by Thomas Kuhn called The Structure of Scientific Revolutions. And this is a classic paradigm shift. There is a field of science that has believed things were one way, and then they resist. To them it's shocking, and then they resist, and then there's these phases of grief. You have denial, and then you have adaptation, and then so we are going through that, but it is really that, and we can look at the history of science, and when we think Einstein came out with the theory of relativity, and he published some papers. It's not like the next day all the physicists said, this is good, we now are going to believe on relativity, but he faced huge opposition, and there was a book of 100 physicists against Einstein, and so this changes take time, and I know for people in this field, it's really shocking that really the disease transmits through the air. But it is a paradigm shift, not only for COVID, because we know that for the flu and for many colds, two of which are also coronaviruses and other rhinovirus, we have known for a long time they are also transmitted through the air. But this has been denied and ignored, So, but now this information is gold. Every year we have thousands and thousands of people who die of the flu. But if we now finally understand that that's transmitted through the air, then we can say, okay, people who are sick should wear a mask. People who are at risk of dying from the flu should wear a mask. We should ventilate better. We should measure CO2. We should do all these things that we have learned with COVID, and that can really be helpful for public health in the future.
It's interesting that you mentioned the book regarding 100 physicists against Einstein as an analogy, because when Einstein heard about that book, he replied that if I was wrong, then they would only need one. So it's same here. It doesn't really matter like who is saying that. If the evidence is there, then scientifically you should really reconsider it. But there is some hope, because WHO has recently updated their guidance regarding ventilation. So they don't talk about aerosols that much, but they do say that ventilation is important. So, but if they don't talk about aerosols, but they say that ventilation is important, so what is their kind of idea there?
We've been complaining to them for a long time about this, and I think Christian Drosten, who's a famous virologist in Germany and advisor to Angela Merkel, has said it most clearly. We cannot just tell people, do this, do that, put a mask this way, do things that way, and not tell them why, and not explain how the virus is transmitted, because that really gets people very confused. They don't do it well because they don't understand what they're doing, and it generates a lot of resistance. Like what you said, there's a lot of people who resist masks, and it's because they don't understand. So when WHO says, and they have been saying this very strongly since November, ventilation is very, very important. And yesterday they came out with some new guidelines that are actually pretty good, and a lot of my colleagues have collaborated on writing those, and I helped write the previous version for WHO. So now when they say ventilation is very important, why is it very important? If a virus is on a surface, ventilation doesn't matter. If you have a projectile that's going from me to you, ventilation doesn't matter. Ventilation only matters if the virus is in the air. It's floating around like smoke, right?
Right.
If you're spraying someone with a water gun, ventilation doesn't matter. It's only the smoker. It's obvious, right? But they don't explain it. And then they keep saying, yeah, ventilation. But so they are admitting that it's going through the air, but they don't say why. And this creates unbelievable confusion.
Yeah, that does really kind of also probably help feed into a lot of these people that are saying that this is a conspiracy and all of that, and really sows misinformation. But then there are, people that follow you, that follow, other that are scientifically literate and look at things, and they understand that, they have to kind of take maybe matters in their own hands. And I want to actually read a question that actually kind of a little bit moved me when I first saw it. It is from a teacher in the United States. So when we asked people to ask questions to you, it was a really nice one, because he says, besides masks, what is the one thing that I should buy for my classroom in order to protect myself and my students? This district is not well informed, and I haven't heard any discussions about filters. At this point, I don't mind spending my own money to protect my students. And I find it very, moving a little bit that, if nobody else is gonna do something, that at least, I'll do it myself. So what do you say to a person like that?
Well, I say thank you, and I have to say I've done the same thing. I've bought filters for my kids' school, and I donated a lot of CO2 meters. But in terms of what to do in a school, so the very important, the masks, and not any mask. They need to be masks that are a good filter and that fit well. The problem is that 90% of people wear the mask, and you see gaps here and you see gaps there. For a gap, that's 2% of the area. So a very small gap, half the air that we breathe goes through there, and then it's not filtered. The air has to pass through the mask for the mask to work, right? So, for example, someone in my family is a teacher, and the first activity she did when they started the classes in person was, today we're going to look at mask fit. And every kid was looking at all the other kids, and does your mask fit? This mask doesn't work. Let's find you another mask. So that, I would say, is still the most important, to make sure the masks don't leave any gaps and that people have masks of sufficient quality. Then the second one is ventilation, right? You want to remove the virus from the air. And there is two things. If your classroom has windows and you're in a place that you can open the windows at least a little bit because it's not too cold or it's not too polluted or too noisy, then I would say, what you want to get is a CO2 meter, because then with the CO2 meter you can open the windows enough, but not more than you need to. You know that you are ventilating your classroom well, and if one day is windy, the other day is cold, the other day, you know that you are ventilating enough without overdoing it. If your windows cannot be open, it's too cold, or you don't have windows, whatever, then I would say then you want a filter. And there is two types of filters. You can buy these commercial Hepa filters that is basically, it's like a mask. A mask is a filter we wear. This is a mask that the air passes through it, but instead of being propelled by our lungs, it's propelled by a fan. But it's the same idea as the mask, and the idea is the virus will stay there. And you can buy these commercial Hepa filters that they work well, but they're expensive. Or you can make your own. You can actually, with a fan of the kind that we use in the summer, not to be hot, and some filters that we use in air conditioning systems, you can make your own, and it's a lot cheaper, and they can work well.
Right. So you mentioned CO2 meters. We had quite a lot of questions regarding those, and one kind of main theme was around, what are the values that we are looking for when we are measuring CO2, let's say in a classroom or in any public space? And does that change depending on occupancy, or is that occupancy relevant?
I mean, for the values, to start simple, what we've been recommending is try to keep it below 700 at all times, right? Mm-hmm. Or really to make it a little more sophisticated, outdoors normally is 400. So what we're saying is you don't want more than 300 above what you have outdoors, right? In some polluted cities, outdoors can be 500, and then 500 plus 300, then you can go to 800, right? But that's not very common. So let's just call it, to keep it simple, you want to keep it below 700. Now, lower is better. Indoors there is always going to be some risk. If you're breathing air with 700 ppm CO2 indoors, you are still breathing a little bit of air that other people have exhaled, right? So if you have the ability, because you can open the windows or whatever reason, to keep it lower, do it. But 700 is a good compromise that even in places that have a lot of people and they're very cold, they are normally able to achieve it, right? And the key is, you probably have heard of the model of the Swiss cheese. We have these layers of protection. Masks are a layer of protection. Spending less time is a layer of protection. And ventilation is a layer of protection, right? And then what CO2 meters allows us is to make sure the ventilation layer of protection is working as well as possible for a given space, right? And what we see, and there is many colleagues, so as I said, we have donated a lot of CO2 meters, and we are working with many people. If you look at the hashtag COVIDCO2 altogether in Twitter, you'll find many people doing this. And what we see is that in a classroom where you have the windows closed like any other time, you may have 2,000, 3,000, 5,000. I've seen up to 7,000 parts per million, right? So then the question is not, do I need 700 or do I need 650? The question is, you need to get down from 3,000 and get to 700. That's the biggest step. Then whether you have 700, 800, if you still have to be indoors because it's a classroom and you have to, just keep it as low as possible. Don't obsess about whether it's 600 or 700. Obsess that it is not 3,000 or 5,000 or whatever.
So, but if we're talking about 5,000, then it's already, dangerous for your health without COVID, right? So it affects all of your cognition and all of that.
This is what has been really surprising to me. I would get in the car with my family, and in half an hour we were at 5,000. That's actually, and I'm wondering now if there is car accidents that happen because we get dumb with high CO2. And I have not found any research on this, but to me it seems like a likely hypothesis. And the same in many classrooms and things like that. I mean, we have known actually before the pandemic, we knew that CO2 makes us more stupid, right? I mean, if you are at 1,500 or 2,000 ppm of CO2, students do a lot worse the exams, and people in companies make worse decisions. Now, can you imagine, Tom, if there was a company that made a pill that made us twice as smart, like some kind of Viagra of being smart, and I mean they will charge us a fortune for a pill, but we have it available. We just have to ventilate, and we get smarter. Yet this has been ignored for a long time. So this is one thing we've been saying, this investment on measuring CO2 is not just for COVID, it's forever.
Right, yeah. So it's not just for, one is COVID, then next probably we'll have another airborne disease, so we'll have things in place, and also the fact that, it does affect both our cognitive capabilities, and also our immune systems are affected if in higher CO2 environments. So there was one interesting question regarding also CO2 meters from one of our listeners that I found quite interesting, and I want to hear your point. Want to hear your ideas about it. He asks, so he has like a CO2 measuring device. This specific person has RNet4, but he's asking how can he potentially how can people use CO2 measuring as like a citizen scientist in a meaningful way that could help. So I know that there is that you retweet a lot of public, also Dr. Berger retweets a lot of public space CO2 measurements and things like that. So do you have any interesting ideas what people can do with that?
I mean, I think people should do experiments in places that are important to them, right? And I've been surprised by people's creativity. I mean, some people have taken it on airplane rides and done images of that, or a lot of pictures and graphs. Other people have taken it into classrooms and say, this is what happens if I do this is what happens if I do that. Other people have gone from supermarket to supermarket. And saying, and you find, for example, that some supermarkets are very well ventilated and others are very poorly ventilated. And it actually is not, you would think, the expensive ones are well ventilated and the cheap one, and it's not that way. It's something else, that is surprising. So I would say you should investigate. I mean, we're in the pandemic. Investigate all the places that are important to you, where you go or with your family goes, and educate people. There's a lot of people who still haven't heard about this or are very confused. But when you go to a supermarket or something and then you show the person in charge, look, this is your CO2 and it's high and you need to do something about it. I mean, there's some people who still ignore it, but a lot of people are curious. It's like, what do you mean? What is that? And so I think that there is a lot of, I don't know if it's called, if I would call it citizen science per se, maybe more citizen activism almost, but
right.
But I think is what we need right now is to really measure everywhere and educate people so that this becomes not something unusual, but something like everyone does, right? I mean, these things take time. It's like at the beginning of the pandemic, as soon as I heard of the virus, I was going into the supermarket with an N95 and everyone looked at me like I was a Martian, right? And then later I started going everywhere with my CO2 meter and everyone was like, this guy is crazy. And, but now everyone wears a good mask and it has become normal, right? So we need to work for CO2 measurement that is a very useful thing that's not very costly to become commonplace and become accepted and become well known.
So do you know if there are any studies that are doing these kind of surveys, going into public places and comparing, for example, in a city or in some location, how is the CO2 level, or is anybody looking at it from a scientific perspective?
There are people doing studies in kind of from a more scientific point of view, but there were already many studies that had been done before for these other reasons that we discussed. So there is many publications. So it's, for example, a publication about schools in California, and they found that they were very poorly ventilated. They were changing the air every 3 hours. Or there was another study about the schools in Madrid, and the European Union says, and actually the Spanish government, the laws say CO2 should be below 1,000, but there was none of the school was below 1,000. All the schools were above the legal limit, and nobody knew because nobody measured, and after the report came out, they didn't do anything, So the information is there. I think what we need is, and the laws exist in many places, but they are not enforced. So what we need is citizen pressure to say, no, this is important, and it should be done. Because ventilation, measuring CO2 is not that expensive, but ventilation can cost a little more money depending on the building, right? And that is where the politicians or the companies prefer to look the other way and not do anything rather than spend their money. So we kind of have to keep telling them, no, this is important. If you don't measure CO2 and you don't make it public and you don't convince us that your business is well ventilated, we're not going to come to the supermarket. We're going to go to another supermarket that's well ventilated. That's how we make change.
Do you have any, let's say, good examples of countries or of places that have really implemented this in an enforced level where something is where they're actually requiring for public places to monitor CO2?
Before the pandemic, this was already a law in Taiwan and in South Korea, which are countries that have also done much better for COVID. So as I understand, in Taiwan, by law, every classroom has to have a CO2 meter that's visible. So this was already a law, and in South Korea became a law more recently. Now with the pandemic, there have been many places that have been, so I know some regions or some cities in Spain and in Belgium and different places that are doing this, but it's all from the bottom up, right? Because as I said, all the public health authorities, all the health ministries, WHO, to them, because to understand why CO2 is useful, you need to accept that the disease is transmitted through the air. And since they are so close to that idea, to them the CO2 is very distant. So there hasn't been any country I know that the Ministry of Health has said, we have to do this and we're going to pay for it. But it's all from the bottom. One school, one city, one region, has come out and said, I'm going to do it. The first time I heard about this was in Belgium. There was the mayor of Krakijnen in Belgium started doing this. And when I heard about it over the summer, I thought it wouldn't work. It's like, and then I was talking to him, it's like, that's a good idea. So it's not my idea at all. I learned from other people, and then I investigated it, and I was like, this actually can work as a way to reduce the probability of infection.
Okay, so we're gonna have one last of the pre-prepared questions, and then I'm gonna switch to YouTube and check what people have asked. So you have still the possibility to ask questions as well. But one of the subscribers asked. So CO2 is essentially a heavier gas, right, than air, and it accumulates more on the bottom. And it doesn't happen like that, right? So
it's heavier, but that doesn't happen in the atmosphere. So that can happen if you have a gas in a box and really doesn't move. You can get that gravitational stratification, but in the atmosphere that doesn't happen because the air moves and turbulent motion moves the air all together. So CO2 does not settle in the bottom. CO2 is well mixed in the room. Yeah.
And that is also true probably for the virus particles, or is that different?
That's why we call them aerosols. It's a solution in the air. So an aerosol is enormously bigger. It may be, more than 1 million times heavier than a molecule of CO2, but it still floats in the air because it's small enough that it can follow the air currents, right? So, slowly over many hours, it does settle down to the ground. But, it's the same as when someone smokes, someone smokes, these aerosols are enormous compared to a molecule of CO2, and they don't fall, they don't stratify, they mix, they fly around as we're used to seeing.
Okay, now that does make perfect sense. So let's jump to the questions that we have from people. So the first question comes from Estonia, and that came in when we were at the very beginning. So they are asking whether there are any physiological reasons why some people are transmitting the virus and others not. And can we say that in this case transmitting is the same as producing aerosols?
Well, I mean, I think, as I said earlier, aerosols is the main way the virus transmits. I don't think it is the only way the virus transmits. I think someone really spits on you, or you really do the surface thing, it is possible you get infected in other ways. Now, in terms of the aerosols, why do some people transmit a lot and not? It is not well understood. There was a study out of MIT a couple of weeks ago that said, older people or people who are more obese or who are more sick may produce more aerosols, but they don't really know why. We do know from before the pandemic that when you have people talking and you measure how many aerosols they produce, some people produce many, many more, 10 times more, even 100 times more than other people, but we don't understand why. And the same with the virus, as I was saying. There is people who, just when they breathe, exhale a lot of virus, 1 million virus per hour was the average, and other people not at all. It was undetectable, So, but it's not understood why. It may have to do with things like the viscosity of our fluid, or some geographical aspects. Like at the end, you have the air going over a surface, and then it has to pick up a little bit of fluid, kind of like when the waves break in the ocean. So we think it has to do with the geography of our respiratory system and exactly how it's shaped and what kind of liquid do we have, where do we have more and less virus. So, I mean, but those are very complicated things to study, and so far it's not known why. So we have to assume, I mean, it would be great, right, if we said blonde people are the ones.
We just lock up all the blonde people.
or whatever, right? But it's not. There is nothing like that. So we have to assume anyone could be infected, right? And at the same time, we have to realize that it is not surprising. Many times people tell me, "Oh, I don't believe this thing that it goes to the air, because in my office or in my school there was someone who was infected and nobody got infected." And it's like, no, that's what we expect. 3/4 of the time we see that there is someone who's infected and they don't infect anybody. That's the way the disease is. It has a lot of dispersion, as we call it.
Okay, yeah. But this also kind of goes into another question. So I'm skipping some of the questions that we already answered in our conversation, and there are people also participating in the discussion in the comments, so that's also nice. But here's a very specific example. So in a 10-floor building, closed with without any ventilation, the air stays in the building cube, so inside of the buildings, and contain aerosols. And can it like enter some apartments, like once every time a person opens a door, for example? Can it be transmitted through the HVAC system to different parts of the building? Can they travel as well? So how is it?
It's possible, but it's not very likely. So this virus is not very contagious, so it needs help. As I was saying, we help it by talking to someone very close or by sharing the same room for a long time. That's when a lot of people get sick. Now, it is possible, and there is a case in Australia, for example, recently, there was a committee that investigated it, and there was a security guard that was sitting 3 meters from the door in a hotel, and there were people who were infected that were inside the room, but there was some air coming from under the door, and the person was sitting there for a long time breathing that air, and then that person got infected. So it's possible, but it is not very likely. And if you think, well, the air that comes from one apartment and comes into another apartment or things like that, there's also some cases in China where they have been infected through the tubes that connect the apartment. So, I mean, what you have to, if you smell the cooking from other people or you smell the cigarette from other people, that's a sign that you're getting air from other apartments, and you should try to find out where is that air coming, and you should close that, But otherwise, I wouldn't think it's very dangerous, no.
Okay. So, so this is maybe something a little bit technical regarding CO2 measurements, right? So the question is, how long do you have to leave the CO2 monitor unaffected by yourself and the breath to get like a stable reading? So I would, let's say, a bit expand on the question. So what are some of the best, let's say, tips and tricks for installing the CO2 monitors? Where should they put it? So what do you suggest on that behalf?
Well, if you're going to put it in a room, in a classroom, in an office, I would say put it, if you can, in the middle of the room, but maybe hanging from the ceiling, something like that. Try not to put it in a wall. Don't put it, if you put it in front of someone, then that's not going to be representative. Or don't put it in a window, because then you're measuring what's outside, So in the middle of the room, at the height that people are breathing would be best, but not too close to anyone, right? Now, if you're doing, and normally, I mean, it depends on exactly the meter. Some of them are a little slower, but like with the RNet ones, in a couple of minutes, it becomes, that's all you need to get a new measurement, And with many instruments, it works that way. In a couple of minutes, you have a measurement. And one thing you can do that's very useful is you can take the meter and put it like on your belt or put it in your pocket, and then you walk around, you do what you're doing, and then there is enough air coming in and out that you will get a very good measurement. So, for example, I went to the doctor the other day, and I had the CO2 meter in my pocket, and I could see that it was high when I was in my car, then it was low in the doctor's office, then it was going up as we were all in the room. And I left, and it was high again in the car.
Okay.
And, that can be, and it was just in my pocket. I never took it out. And
really?
And that kind of thing works very well.
And it mixes well with the air and also inside of your pocket? Doesn't it isolate it a little bit?
No, because I mean, if you can imagine, if you're wearing, I had one of these jackets that had a pocket, and those things are air goes through them, just like air goes through a mask. Air goes through them, and if you were trying to measure every second or something, then you would see that it's slower. But if you're trying to measure every minute or every few minutes, it's perfectly fine.
Okay. So one last question from the audience. There I see in the last kind of comments, there's a discussion going around regarding air conditioning. So by air conditioning, we are thinking about things that don't take the air from outside, but recirculate the air in the room. So what is your kind of opinion on this? Does it make it more dangerous and make the aerosols disperse faster, or does it matter?
I mean, at the end, if you have one of these split air conditioners or one of those in the window, it's just like a fan. It's just mixing the air, right? So then it's good and bad, because if there is someone who's infected, close to, and you are close to that person, there is much more smoke there, So for you, if you are close to someone infected and you mix the air, you lower the concentration. But from people somewhere else, if you now mix the air faster, the virus gets to them faster. So it's not a huge effect. I mean, I think what we have to, and there are air conditioners, like these split air conditioners, that come with a good filter, but most of them don't, and people have not been asking for that. And if you try to put a filter, the fan is not powerful enough to move the air through the filter, so then your air conditioner will freeze. So if you're gonna buy a new air conditioner, then get one that has a good filter. And if you have an old one, then you have to open the window a little bit or do things outdoors, or realize that the air conditioner is not making it safer. Or maybe you can have a Hepa filter in the space or something.
Okay. No, that really helps to clarify these things, because this air conditioning is typically one of the big questions, whether or not that helps or that makes the situation worse. Well, we have been talking for almost an hour, so this is mainly a kind of the time that we have. So I guess one last question before we leave you. How do you see like this situation developing? How are you hopeful for the future? Do you think that new guidelines will come and we will have better ventilation everywhere and CO2 meters everywhere, or there's still a lot of things to be done, and maybe people attending this webinar could do some of these things to help?
Yeah, I mean, I think there is changes in the air, I mean, and we hear from people who are in contact with WHO and CDC that they are finally accepting it more, and I mean, I think they will change and say things more clearly in the future. I don't know how quickly, but the problem is that there is the public health organizations, but then in every country, in every city, then the politicians basically have to decide to spend money on these things. And really, there is a quote from an American activist that said, never doubt that a small group of thoughtful, committed people can change the world. Indeed, is the only thing that ever has. And I think that encapsulates it perfectly. We all need to become activists and keep reminding the politicians that this is what they have to do. I mean, there is actually people from a regional government in a country we work with where they have told us directly, we are hoping COVID goes away so we don't have to do anything about ventilation in the schools.
Oh,
I mean,
wow.
they told us that. So our strategy, and a lot of them don't say it, but that's what they're hoping. So because it costs money and because they rather do other things with the money, So I think we have to all keep at it, and not just with COVID, but continuing. It's like, where is the ventilation, And this is where these little CO2 meters are really, because people cannot hide, Otherwise, companies could buy some sticker that says, good air quality, and you don't know, you cannot verify. But with CO2, they really cannot hide. You can take a picture of their company or their shop with high CO2, put it on Twitter, and suddenly they cannot hide anymore. So we need to all become citizen activists.
Essentially, yeah, just try in the beginning, with a soft approach, and if they don't listen, then actually do go and make a picture. That's very helpful, and I think I learned at least a lot today, and I hope it was the same for our viewers. We had quite a lot of people joining us, so thank you very much, Dr. Jimenez, for your time. I know that you are super busy. And we hope that the CDC will and the WHO will make it official so that you can finally go on a vacation. Okay.
I hope so too. Thank you for your time.
Thank you very much. Bye. Thank you everybody for watching this wonderful interview. So I'm just gonna steal a couple of more minutes from your time, just to kind of explain the things regarding ARANET and regarding our friends, the ELPO wall. Effectively, so what we discussed today, which was the main kind of theme of this, is that CO2 is really a nice proxy for this let's say the risk factor of COVID transmission. So if we are breathing out these aerosols, we are also breathing out CO2, and as we already discussed today, one of these things that can help is actually measuring CO2. And one of the options of how you can actually measure CO2 is ARANET. So this is this sensor. Now you see also it in a larger on a larger screen. So this device measures CO2, measures temperature, relative humidity, also atmospheric pressure. It has a really nice Bluetooth app, and now we've also updated the app so you can use the readings from that app and cast it or screen mirror it to a larger screen in a restaurant or wherever, so you can broadcast these readings saying that, my facilities are safe, you can come here and dine, you can, and we're trying to get this out more into the public. But the RNet sensor doesn't end only as a standalone sensor, so this is a nice starting tool. It does the reading once every minute, once every 2 minutes, 5 or 10 minutes, and you can carry it around with you wherever. It has an e-ink display on top of it, so it's very power efficient, and leave it there, and get historical measurements from the Bluetooth app. But if you have like a larger facility, which is, for example, like a large school, you can actually have one of these in each classroom. And then what we have is a base station like this, which is connected to, you can connect up to 100 of the ARANET 4 sensors wirelessly to the base station, and it uses the 868 megahertz frequency in Europe and the 920 in United States, which is a very low frequency which allows for large coverage. So you can use, typically we see that in 90% of the cases you can use one of this per school, and it will collect all of the readings from all of the classrooms, and then you can get data about which classrooms are worse, which classrooms have better ventilation, which classrooms maybe to avoid, how to plan better your day, which teachers are taking ventilation serious and which are not. So that's all kind of nicely agglomerated into the RNet base station. And then up on top of that, we also have the ARANET cloud solution that allows you to have, so if you have multiple locations, for example, we have several school districts in the United States that are using this, and you can have one base station per school, but then you can have all of them in a single dashboard, connected into a central monitoring place to get all the readings, to get all of the data from a larger environment. So essentially, the kind of I would say motto of ARANET is one that we have stolen from William Thomson, or more commonly known as Lord Kelvin. And a bit more than 100 years ago, he said that you can only improve what you can measure, and this is the main idea of ARANET. Bringing these measurements, in the most easy to use and the most, the most comfortable fashion, so that you can improve, your situation. And if we're talking about improvements, then I would like to mention our friends also at Alpua, which are manufacturing this lovely wall that we have also here in our studios. And this plant wall actually is helping with the air quality, and it's not just CO2. What they do is also using the wall as a biofilter, which absorbs the plants and the roots on the wall itself, absorbs things like things like volatile organic compounds, dust, fine particles, and other things. So you can learn more about them here. There's their website and their email. And once again, my name is Toms Rekšnja. I am the marketing director of ARANET. If you have any questions, you can email them at info@aranet.com. Visit our website to learn more about it. And thank you for watching this webinar. I hope it was very useful for you. So stay safe, make sure, that you are going to places which have good ventilation. Make sure that you have good ventilation at home, at school, at your office. And until next time, bye-bye.